Senior Moments, sponsored by the Empowering Seniors Group on News Talk KVNU, 102 FM and 610 AM.
Good morning, everyone, and welcome to the Senior Moment Show. My name is Bryce Patton, here with the boring Sid Roeder, who would not sing me a song this morning.
Oh, wow.
How are you, Sid?
I can't believe you put that on there.
Why not? You're usually really wonderful, but you wouldn't sing to me, so
I guess I'm not wonderful today.
you can earn it back. I'll let you. Well, we have a lot of information to go over today with our new guest. But before we do that, would you mind going over who our sponsor is?
I am delighted. Our sponsor is the Empowering Seniors Group, which is a group of professionals that have dedicated their time and effort to provide information to seniors, their family members, and really anyone that loves to listen to us. If you'd like to learn more about the Empowering Seniors Group, you can do so online at empoweringseniors.info, or you can email us at empoweringseniorscv@gmail.com, and the CV stands for Cache Valley. And lastly, if you have any suggestions for this show, anyone you would like to see us invite, you can call me personally at 435-512-6406.
Okay, you definitely earned the wonderful back by doing that, because I hate doing that so much. Well, let's introduce our guest. We have Ben Boyer. He is a family nurse practitioner at the Foot and Ankle Center, and we have Lily Knudsen, and she is the marketing director there. Welcome to the show, guys.
Thank you very much.
Thanks for having us.
Glad to be here.
Yeah, we're excited to have you here. You have some news for us about your clinic, and we want to kind of go into that. Lily, would you mind explaining? You were telling us before what the WIND Clinic is. Will you tell us what that is?
Yes. So the Foot and Ankle Center, we've expanded a bit. We've actually opened a new branch that is called the WIND Clinic. It's a new clinic located on the backside of our building. And WIND is an acronym. It stands for Wellness, Infusion, Neuropathy, and Diabetes. And these are the areas that clinic focuses on. Ben works there and runs an infusion clinic there. He also sees patients for primary care, diabetes management, other wellness-focused concerns. And then we also have another nurse practitioner, Kim Tag. She likewise helps run the infusion center that we have there, where we treat a lot of neuropathy. And she sees patients for hormone balancing and other needs.
Yeah. No, that's a great introduction to the WIND Clinic. We've had that separate section open now for probably 6 to 8 months.
Yeah.
There in the Foot and Ankle Center. And we'll go into some of the reasons why we decided to expand in those ways as we talk about diabetes, as we talk about neuropathy, and as we talk about the things that really affect our health that we see a lot of at the Foot and Ankle Center.
Yeah, so maybe let's dive into a little bit. I mean, everybody talks about diabetes, but I don't know if everybody understands diabetes fully.
Yeah, thank you. And I think that was really something we wanted to focus on today, is discussing diabetes, maybe even doing a quick Diabetes 101 for the listeners out there to help them understand a little bit about what that is. And like you said, Sid, most people have a basic understanding of what diabetes is, but in essence, it's a disease characterized by high blood sugar levels. So the body is either unable to produce the hormone insulin that can help your body to metabolize glucose, or it becomes resistant against it. So your body might be producing it, but not using it correctly. And most people know that there's 3 types of diabetes. Type 1 diabetes is more commonly found in our pediatric or adolescent patients. They unfortunately stop producing insulin and will be on insulin for the rest of their life. Type 1 is a lack of insulin. Type 2 is what's more common in the United States and around the world, because almost anybody can develop type 2 diabetes as we get older. And it's characterized by the body either not producing enough insulin, or insulin is there but is unable to be used by the body in the right way. We call that insulin resistance. So that's kind of type 2 diabetes. And then gestational diabetes, or diabetes that occurs during pregnancy. A lot of people have heard that, where the body is just not able to make and use all the insulin that it needs when somebody is pregnant.
Wow, that's awesome. So I was wondering, it seems to be with diabetes, there's a lot of different things that people believe about it. What are some of the myths that you see that people think about?
Yes,
diabetes.
yeah. So there are a lot of those. And because everybody kind of has an idea of what diabetes is, sometimes we'll talk about it without maybe having a full understanding of the things that we're explaining. And so some of the common myths, and we'll just go through these. If you guys have questions, just let me know. A lot of the information comes from the University of Michigan, the American Diabetes Association. So you can look things up online that can be very accurate. But some of those myths include, well, I can't really have diabetes because I don't have any symptoms. Okay, and that's one thing that we end up, seeing a lot of people that come in for a routine foot care that don't realize that maybe their sugars have been running a little high, and then all of a sudden the sensation in their feet isn't quite as good. But a lot of people with diabetes don't have any symptoms at all, and you can develop the beginnings of diabetes really early on that can be found through lab testing and evaluation, but that you may not realize that what you're experiencing is the beginnings of diabetes. So that would be number one. Another myth is that people say, now that I have diabetes, I am likely to have low blood sugars, and if I feel funny, I should probably just eat some candy. That may or may not be true. For most people, it's not. In fact, there's diabetic medications that can cause you to get low blood sugars, but not everybody with diabetes will just instantly get a low blood sugar, at least to a level that is dangerous. Blood sugar levels vary a lot. A normal fasting blood sugar should be between 70 and maybe even up to 110. People that are diabetic, though, may have an average fasting blood sugar of 140 to 180, and if their blood sugar drops into what is considered a normal range, they might feel a little bit low, but that doesn't necessarily mean that you just need to go eat candy. We talked a little bit about our food choices, and we'll go into that a little bit more as we go on. Another myth is that I can never drink alcohol again. A lot of people think that, now I can never have a glass of wine or beer or liquor, and that may or may not be true. Obviously, we always counsel people to use alcohol in moderation, but having diabetes doesn't necessarily mean you can never drink again. How about this one? As long as it's whole wheat pasta, I can eat as much as I want. Have you guys ever heard that? Or, as long as it's a healthy food, I can eat as much as I want.
Only.
All right. Even food like that contains fibers and sugars that can cause your blood sugars to range or to increase. So it's still important to be careful with our food choices. All right. How about
Ben,
this
I've
one?
got
Go
a
ahead.
question for you, actually.
Yep.
What are some of these symptoms when you're talking about blood sugar levels changing? What kind of symptoms would you be looking for? You say you feel your blood sugar drop. What does that mean?
And I think people feel changes in blood sugar differently.
Okay.
And depending on whether it's high or low, you'll experience different symptoms. I think if it's okay, we'll touch a little bit more on that in our next segment.
Yeah.
We'll just finish going through a couple more of these common myths. No, you're good. We'll just go through a couple more of these common myths, and then we will spend some time talking about those symptoms in just a couple minutes. How about this one? It's dangerous for people with diabetes to exercise. Not true. Right?
Interesting.
Yeah,
I haven't heard that one.
It's a common myth. Exercise is actually a really important part of controlling your blood sugars because of how it helps your body, how it helps your heart. And then, let's see, maybe just a couple more. Taking insulin means your diabetes is out of control. A lot of people think, I'm on insulin, that means I'm in trouble. That's not always necessarily true either. Depending on the individual, using insulin out of the gate with a diagnosis may be a good option to help you bring it under control even quicker. And then, let's see, maybe diabetes is not life-threatening. That is also a myth. Unfortunately, diabetes, and we'll get into the different things that it affects when we're talking about some of the symptoms, can truly become a life-threatening condition depending on how much it is left unchecked.
Thank you, Ben and Lily, for that information. We're on the verge of taking our first break. Maybe you want to grab a pen and paper, because we'll also have contact information for the Foot and Ankle Center in the Wind Clinic for you in a second. But we're going to take a short break. Stay tuned. We'll be right back.
Did you know 10,000 baby boomers qualify for Medicare every day? Did you know that you'll start to get swamped with mail about Medicare 6 months before your 65th birthday? Did you also know it doesn't cost anything to use an insurance agent to help you navigate through all those offers? Hi, I'm Tracy Ferris with Blue Water Health Insurance. Let me help you understand all the offers you're receiving and find the plan that fits best for your situation. Call me today at 435-890-8155.
This is Mark Thurston with White Pine Funeral Services. The best time to plan is when you have time to plan. Having a pre-arranged funeral gives peace of mind for everyone involved. White Pine will customize your final wishes to fit your needs, from a traditional burial to cremation to a custom headstone. White Pine also accepts pre-arranged plans from other mortuaries, and we will absorb any transfer or revocation fees. No penalty to you. Visit whitepinefunerals.com or come and see us for more information.
White Pine Funeral Services, here when you need us most.
Reed's Pharmacy in Hiram offers free delivery service 5 days a week, Monday through Friday throughout the valley. Just stay home and they will deliver to you. With 25 different suppliers, they won't have the shortage that others might have. Also, with compounding and many other services, they will be able to serve all your needs. In order to stay safe and help slow the spread, please call Reed's Pharmacy in Hiram at 245-DRUG and they will take care of you.
And welcome back to the Senior Moment Show. My name is Bryce Patton with the wonderful Sid Roeder as my co-host, as well as we have Lily and Ben from the Foot and Ankle Clinic. Now, Lily, Ben's given us a ton of information on diabetes, but if someone is concerned or has questions about this or wants to come in and make an appointment, where can they find you?
Absolutely, Bryce. Our phone number is 435-787-1023. And that you can call that number and get in touch with people from the Foot and Ankle Center or the WIN Clinic. Both of our clinics are accessible by that number. And our location is at 435 North Gateway Drive. We are next to Cook Brothers Pharmacy and Wasatch Pediatric Dentistry. We're right in that building there. And just behind in the back of that building is where the WIN Clinic is located.
Wonderful. So we've talked a little bit about some of the myths about diabetes, and then Lily had a really good question. You want to restate that?
Yes. I'm wondering, I want to know more about the symptoms of high and low blood
Yeah,
sugar.
great question, because really we want people to understand if you start to experience some of these symptoms, then you should be at least thinking, okay, where is my blood sugar right now? So type 1 diabetes, again, happens more with our younger population, and those symptoms, often frequent urination, unusual thirst, extreme hunger, unusual weight loss, fatigue, and irritability. So if you're seeing that in some of your younger population, be thinking, okay, I should at least get maybe a glucometer or find somebody that has one and get a blood sugar checked. Type 2 diabetes include many of the same symptoms as type 1, but also frequent infections, blurry vision people can experience, slow healing wounds, which again is part of the reason we brought it to the Foot and Ankle Center, tingling or numbness in your hands or your feet, gum or bladder infections, erectile dysfunction, and gastroparesis or slow-moving bowels are all symptoms of diabetes that can be very, very common. And kind of the big three that we worry about as medical providers are all opathies. So retinopathy, nephropathy, or neuropathy. And what those are damaged cells within certain areas of the body. So retinopathy are vision changes. You would see an ophthalmologist to get that diagnosed, but blurry vision is one of the first things that you see. All diabetics should be getting their eyes checked at least once a year by their eye doctor. Nephropathy refers to the kidneys. Kidney damage can often occur from elevated blood sugars, and so you start to urinate frequently. You feel like you don't empty your bladder all the way. For some people, it actually can cause an irritation of the lining, and so you end up with more frequent bladder infections. That can also be very common symptoms. And then neuropathy, talking about neurons or nerves, is another really common thing that we'll see at the Foot and Ankle Center. People will come in and their feet burn or their feet tingle, or at nighttime their feet are waking them up. And all three of those big opathies are big concerns when it comes to the side effects and problems with diabetes. Diabetes is a huge issue. It's, over 26 million people, now over 10% of the population in the United States that deal with it. And they estimate around 79 people may have prediabetes. So a lot of people, as you mentioned before, that just might not know that what they're experiencing is a problem of blood sugar.
So I've got a question for you, because you mentioned before too that some people have diabetes and do not have the symptoms. Mm-hmm. So first question is testing for diabetes a standard check-in thing when you go for a checkup?
Yeah,
Number
great
one?
question. And we can talk about a word called A1C, which is a lab test that a lot of people will get. Most everybody, as a routine screen, as a part of your physical, will get a glucose level checked. Okay, glucose measuring the amount of sugar within your blood. That glucose level can be a trigger to then proceed to this test called a hemoglobin A1C. Diabetics will recognize that number. The A1C test was developed to give us kind of your average blood sugar over the last 3 months. That average blood sugar really gives us a clue as to how your body is responding to sugar. Common numbers that we see. So if your blood sugar is below 6.5, you are not diabetic. But the range that we really try to hit people, if you're between 5.7 and 6.4, you are pre-diabetic, and that is when you really want to make some changes to try to prevent it from crossing over into true diabetes.
So for someone who hasn't had that blood test done, do you recommend, or do you, I know you can buy a glucometer on Amazon anywhere online these days, and they're not even expensive. Is that something that people should get into?
I think if there is any of the symptoms that we have discussed, if there's a strong family history, or if you just want to know. In fact, we have some coworkers, Bryce mentioned a friend that he has as well, that they're just curious, how does my food affect my blood sugar? And getting a glucometer is a great way to do that. Now, a lot of people, especially type 2 diabetics, we now recommend continuous glucose monitors. It's a small little monitor that inserts into the arm. It's teeny tiny. It doesn't hurt hardly at all to put it on, and it monitors your blood sugar consistently. You can really see, what do I eat? How does it affect my blood sugar? When I exercise, what happens to my levels? And it is a great thing for people to understand how those things can affect your health, specifically in regards to blood sugar.
So I'm super curious going along with that, but you're talking about all the neuropathy and different things. Why does diabetes affect the feet so much?
Yeah, and it's really that third apathy that we were discussing that explains why this was such a big deal for our clinic and for our patients. So neuropathy is damaged nerve tissue that commonly happens when you have elevated blood sugars. Your body can't regulate it around those nerves in your feet as much, and so people will start to experience numbness, tingling, burning, and unfortunately, you don't always feel that just happen. All of a sudden, you don't just say, oh, I can't feel my feet. It's a gradual process, and once you have neuropathy that we know of, there is no cure. There are treatments, and we'll talk a little bit about some of those treatments for neuropathy, but we see a lot of people that come in with a sore on their foot or a wound on their foot, and sure enough, they're living with diabetes. And they've had this sore that has now developed into a big wound that requires a lot of treatment and care to get rid of it. In fact, unfortunately, you hear about a lot of diabetics losing a toe or losing a foot, and it's primarily because of that neuropathy that has not allowed them to feel wounds, infections in the way that they normally would have.
So would you say that there is a problem with early detection in this?
That's a good question. I would say we're getting better at it, especially categorizing now patients that have prediabetes and treating that more aggressively. Is something that we can try to prevent diabetes, but even with those early detection methods, we're still struggling with diabetes in this country. And a lot of it comes now into how do we treat it, how do we prevent it. We were talking a little bit earlier about, what do we do about that? And so exercise, nutrition, supplements, medication, all of those we'll talk a little bit more about in our next segment as well. And it's important to touch on why those are so important when it comes to diabetes control.
Yeah, absolutely. Because I'm actually a fan now of nutritional paths to go there, because I was pre-diabetic and I've actually managed to get away from that, which
Good
is
awesome.
Good
for you. Yeah, that's awesome.
Well done.
So this is the Senior Moment Show. We're coming up on our second break, so I'd like to mention our sponsor one more time, which is the Empowering Seniors Group. If you'd like to learn more about the Empowering Seniors, you can do so online at empoweringseniors.info, or you can email us at empoweringseniorscv@gmail.com, and the CV stands for Cache Valley. We're visiting today with Lily Knudsen and Ben Boyer from the now I've got the Wind
Center,
Foot and Ankle Center and the Wind Clinic.
Thank you.
And we'll take a short break, but we'll be right back.
Hi, this is Bruce with Comfort Care. One of the ways we help loved ones stay in their home is by assisting with daily tasks. The These may include bathing, meal preparation, medication reminders, and housekeeping. We even help with shopping, transportation, and errands. Most of all, we offer a trusted level of care. Let us help you live your best life possible with Comfort Care. This is Bruce, and you can call me at 754-7676. Comfort Care, 754-7676.
You have a lot of options when it comes to buying or selling a home. Do you list it online, sell it yourself, or do you have a realtor help? It's a major financial and emotional decision. A realtor is the liaison between buyers and sellers and really helps you navigate complex contracts, deadlines, and disclosures.
Hi, this is Sid Roeder with Achievement Realty. I work for you to get the best outcome for your situation. Let me earn your trust with a free consultation and a free market analysis. Call me today at 512-6406. Then list it, sell it, and move on.
It's tough knowing how to care for an aging parent. Mom has always been there for me, but now I need to be there for her. When we found out she needed surgery, I wondered how I could attend to her needs and still be mom to my kids. I was so relieved to learn about transitional rehab at Maple Springs in North Logan. From the nurses to the physical therapists, it was like their whole staff was focused on helping Mom get better. Maple Springs in North Logan was an answer to my prayers.
Learn more at maplespringsnorthlogan.com or call 753-9400.
And welcome back to the Senior Moment Show. My name is Bryce Patton, here with Sid Roeder, as well as Lily and Ben from the Foot and Ankle Center. You know, Ben, you've been talking about diabetes, losing feet, going numb, losing your vision. I mean, that's pretty scary. What kind of things can someone do if they're worried about that to, you know, maybe prevent this, or maybe if they have it, make the situation better?
Yeah, no, great question. And Sid, I appreciate your example, you know, because a lot of people are in that category. We talked about 79, 80 or more million people that have prediabetes. And truly, lifestyle changes have to be a part of your treatment program. There is no magic bullet or magic pill that can make it all better. We'll talk about some things that help in a few minutes, but lifestyle is just vital to making a change. And so when you think lifestyle, I think the two big things that we'll hit on, number one, nutrition, and number two, exercise. There are some of the easiest things that I ask patients to do, but some of the hardest for all of us, myself included sometimes, to adopt. And so when it comes to nutrition, I think it's really important for people to understand their diet. What do I eat? And for those that are really curious, how does what I eat affect my blood sugar? So using a glucometer, getting a continuous glucose monitor, those things are helpful. A lot of conversation about carbohydrates when it comes to diabetes. Our body needs carbohydrates. They're not all bad, and they come in almost all variety of foods, but the types of carbohydrates that you eat play a big part, and too many carbs can cause high blood sugars. Not eating enough carbs can make you feel low energy. So it's definitely a balance. So where do carbs come from, you guys? Just generally, where do carbs come from?
Pasta.
Yeah, that's what I was thinking. Pasta. Pasta and bread.
Cereal.
Very good. So you're absolutely correct. They come in all of those things. In fact, those are probably the ones that people know the most. Bread, rice, pasta. But there's carbohydrates in fruits, in vegetables, milk, yogurt, milk products, sweets, we know, and then many drinks, right? A lot of drinks are sugar-based or based on carbohydrates. And so when you're making choices when it comes to that, eat complex carbohydrates as opposed to simple carbohydrates. Do things that will help you to minimize your total carbohydrate intake. And specifically when it comes to fluids, don't drink your carbohydrates. So, you know, don't drink sugary drinks. Fruit juice is included in that. And then your whole milks even are going to be really high in carbohydrates. So really knowing your nutrition can make some big changes. Mm-hmm. Number two is definitely exercise, you know, and this is something that is hard to talk about because we were talking earlier when you say, what do you want to do? Most people don't want to start an exercise program, but physical activity can help to lower your blood sugar for up to 24 to 48 hours after you do it. So that's part of the reason why exercising 4 to 5 times a week for at least 30 minutes is going to be a good thing that will help to lower your blood sugar. It also lowers your insulin needs. It helps your heart to decrease heart risk. There are just so many other things. Improved mood, improved sleep quality.
Hey, now, I have a question. So when you're saying you need a half hour of exercise 4 to 5 times a week, does that mean, hey, I need to be sprinting and sweating like crazy, or is a walk good enough?
Yeah, that's a great question. And actually, we consistently tell people, start slow. If you go too hard, too fast, you're not going to continue with it. And so walking is a great initial choice. For some people, their joints hurt. So swimming or doing a recumbent bike or exercise bike can be great options as well. Just do something that gets that heart rate moving and is outside of your normal routine. I have too many people tell me, well, I'm really active at work, so that's my exercise. That's probably good, but if you're still dealing with prediabetes or diabetes, your body has adapted to that. It needs to be something that's different than your body is used to, but walking and simple activities initially are a great way to do it. The other thing I would add to that is find a partner. It's a lot better when you've got somebody else to do it with. We're all motivated by each other, and having some goals that somebody else is pushing you towards is a great thing. If 30 minutes is too much out of the gate, start at 10 to 15 minutes. I would applaud any activity, especially if you were starting from ground zero.
Yeah, that's very true. Let's maybe dive a little bit, because our time's running quick here, into some medications or supplement things that you can do to help.
Yeah, so good question. And we do get to the point, right, with a lot of people where we need to focus on medications. The medications that we use, some common names, metformin, Januvia, Starlix, Actos, Byetta. And then, of course, Byetta is in that category of the GLP-1s. A lot of people have a lot of curiosity and have seen improvement from these glucagon-like peptide receptors that stimulate how your body either releases glucose into the bloodstream or uses insulin. So the GLP-1s are the Ozempics, the Mounjaros, the Trulicities, those once-a-week injectable medications. All of the different medications will help to lower your blood sugar. These ones have really gained traction because it's been shown to be helpful with weight loss as well as with cardiovascular health. I am a proponent for the medications, but it's not right for everybody. I think it's really important to talk to your medical provider about, is this right for me? And if I'm pre-diabetic, should I even be taking this or not? What are the side effects and how can it affect me? One thing then maybe we'll just close up with is, neuropathy is a treatment or is a condition of diabetes that affects so many people and can be really difficult to treat. It's something that we're really striving to help patients with at the Foot and Ankle Center and through the WIND Clinic. The options that we have through a treatment called CalMAR, medications, or insulin infusion therapies are really exciting for these types of patients that need that type of care.
That's wonderful, Ben. Thank you so much. We're already at the end of our show here, so I don't want to step out without giving Lily another chance to mention the contact information.
Oh, absolutely. Our phone number is 435-787-1023. And again, you can reach both the Foot and Ankle Center and the WIND Clinic at that number. Or you can go online and visit us at cashvalleyfeet.com.
Thank you, Lily and Ben, for coming in. That was very educational. This is the Senior Moments Show. We're at the end of our show, and we hope you tune in again next week.